Hi, good afternoon, everyone. My great pleasure meeting distinguished panelists on the dais and Professor Kharbanda. And I'm more, excited because of Mr. Raj Kumar Sharmaji, who has, created this AICRA, because of which we all are here and listening, and we are having the full ethos to basically build this ecosystem, which is very, very important. Doing work is one thing, but unless you build a right ecosystem for the particular targeted area, you cannot achieve what you are actually looking for. And that is why most of the setups, organizations, or even the organizations, big or small, they fail. Because you have to have a very large perspective in terms of building the ecosystem first. Because once a nice, well-regulated, well-responsible ecosystem we create, then it helps to all people, all people, whether they are in, any kind of constraint. Because we basically try to build a system which is accessible, affordable, and safe and quality health to all. That is our basic objective. And once we achieve that, then only our all efforts can be recognized. Otherwise, we are just doing without reaching to any destination. Now, coming to the point of transforming healthcare with AI, with scopes, policies, roadmap. So if we talk about the scopes, yes, of course, in healthcare, let me take you back to how medical devices basically entered, because if you understand the medical devices, which is, again, a bigger technology in healthcare, right? Thereby, you can understand why and how the AI can be implemented or penetrated into the healthcare in different specialities for the treatment areas or for the disease management areas or for the prevention point of view or from the prediction point of view or from the diagnosis point of view or overall healthcare management, or from the perspective of public health, when we talk from the government point of view, or when we talk from global point of view, right? So let me give you my introduction, how I came to this place, and then I can take you toward this focused area of AI. I started working on AI and robotics since 1992 when I was a university research fellow in 1992. And thereafter, I entered into healthcare technology business in India, started with 1993. And when I entered to this healthcare technologies, particularly the cutting edge, the next generation, digital health technologies part, people are talking now big about digital health, but digital health I launched in 1993 in India. And during that time, every doctor, every hospital, every government stakeholder, they were saying, what is the role of technologies in healthcare? Because they know pharma, medicine cure, and does a lot of work. But in treatment and in those areas, our doctors are sufficient. They are well qualified and this and that. But I used to basically push them hard. I need to basically educate them very hard about how and why the technology is actually can become the backbone of your treatment area. How you are doing the surgery, how you are doing the diagnosis, how you are doing the basically the disease management. Technology has a lot of capability, a lot of power, right? But yes, in technology, what is happening, you require, everything, delivery, all the delivery should be accountable, responsible. It should be reliable, because the healthcare is related with somebody's life. It is not like in other industry, whereby, okay, you make something using AI and launch it, and then God only knows what is going to happen. Because there it is not related with somebody's life, right? People are buying on e-commerce, companies, startups are working on AI and this and that. But here in healthcare, we are talking all about, somebody's life, how best we can save somebody's life, in particular this disease or that disease, right? And there, how technology can basically empower the physician, the surgeons, right, for bringing a better treatment outcome. That is our objective of basically of technology bringing in healthcare sector, right? Now, when we come to, so in my experience, I built, set up, founded, and serially invested as a serial health tech entrepreneur with 16 startups, all global in health tech and digital health and AI health. Benovymed Healthcare is my 16th startup, founded, and I'm the board chairman and also the chief of global R&D and AI health innovation. Here what we do, we are solving many complex problems related with chronic disease management, right from prevention to complete disease management area. Now coming to the main topic, right? If you see the AI has a huge opportunity, the way medical devices got huge opportunities, and today the medical devices is basically penetrated into all these medical specialties, specialties or super specialties area. So everywhere now medical technologies are involved in healthcare. So now medical technology became the backbone of healthcare system. Without that, the healthcare system itself is handicapped, right? Similarly, now with AI has huge opportunity, huge scope. Similarly, AI can be applied in healthcare in all these medical specialties and super specialties. So one of the area of working in treatment area, the other area is in the, I would say, the diagnosis area. The other area is in the, basically the overall disease management area. The other area is related with the public health, related with the pharma, drug discovery, related with the, the oncology. If you see in oncology, there is a called precision oncology. So precision oncology is a new science in oncology, which is basically using everything related with big data and AI, right? And of course, it is very expensive. It's expensive technology. The treatment is expensive, right? But here in AI, when we deal with all other treatment area, the objective here is to make it affordable, to basically provide a powerful tool to the clinician, to nurses, to other stakeholders which are inside the hospital system, right? Say for maintaining the medical supplies within the central store of hospital, or for predicting different disease or predicting related with what is happening with the patient for monitoring purpose, or tracking their medical condition when the patient is inside the ICU, or when the patient is discharged from the hospital. So there are so many applications which can be built right from ground zero into complete end-to-end delivery using this AI. Now, yes, opportunities are there, but at the same time, it has a lot of challenges also. Challenges in terms of, as Dr. Carr has explained, yes, challenges is related with the adaptation, because adaptation is one of the biggest challenges. We launch technology, but if it is not utilized or implemented or executed in right manner, and that too in unbiased manner, because the objective is that nobody should use it biasedly. Because if it is used biasedly, then it is creating big problem for every patient, big problem for the whole healthcare ecosystem. We have to avoid that. We have to restrict that. And let me tell you additionally of my these multi-hat role, I am also the expert member for digital health and AI health innovation with the WHO Geneva, whereby I'm basically working with more than 40 countries, governments, and big corporate international hospitals on advising them how to roll out digital health technologies in their local setting. Because what is the challenges in US or other developed countries, the challenges are not same in our country. We have a different kind of challenges. And we have to solve our problem locally, right? So thereby, we have to use different kind of, strategies, different policies we have to adopt. The self-regulated policies, which is called responsible AI. Before responsible AI, which came last year, I was talking as a WHO member with many international forums, including few were with India and Israel, and there were few sponsored by Apollo Hospital after first COVID time. So the basic thing is that we have to be responsible when we are using AI. Otherwise, it can create big problem. And the people who are not knowing about this, they will be clapping. Oh, it is AI, so that means everything is going fine. And you are doing nice job. No, it is not. It can create big danger for the society, for the patient. Because if it is unbiased, then only it is going to help, right? Then only it is going to basically empower the patient, empower the clinician, empower the government. Because if we use in right manner, regulated manner, and with maintaining all ethics in terms of the clinical side, ethics in terms of the delivery and commitment, as per what model we have developed before, creating the AI modeling and delivery, right? So those ethics are very, very important, because when we maintain that, it basically work very well for public health from the government point of view, so that our government can basically have a very good monitoring and management over these disease, which we call as non-communicable disease, NCDs, and communicable diseases like COVID or other infectious and emerging and re-emerging diseases like COVID, dengue and Ebola, and there are so many, even the disease like rickettsia. Many people, many even physicians, they are not knowing about rickettsia disease. But in India, many children, they died because of rickettsia. And the media and many hospital side and the system side, they were saying it is some other disease, right? So there are many things we need to learn, we need to adapt, we need to follow, we need to basically work together. We have to work together with all stakeholders, with government, with institutes, for developing these kind of solutions, technology, AI-based solutions, because these technology solutions only can be developed when we have well unified data. And if you see, because I deal with so many countries, developed, underdeveloping like India and many countries, so I'm finding there is a big variation in terms of data collection. Everybody talks about we have quality data, but nobody knows what is the meaning of quality data. Because data See, if you give any kind of data to AI or a data scientist, they will do. Because their job is to get the data and work on that. They will do. But it is the think tank who has to see what kind of data you are getting. Whether the primary data is basically clinically it is good or not. Because data, one point of data is that, okay, from data science point of view, okay, this data is workable. But we have to think data from the clinical point of view. So like this. So a lot of things we need to work out. Thank you so much for giving me this opportunity. You have any questions?
Maybe we can take up questions after all the speakers have given their views.
Please?
Yeah, we will take up questions later on. And we'd like to thank you, sir, Ambassador Mahendra Singh, for telling us